my name is Ron. I'm an herbalist, herbal consultant, herbal formulator, and I work in natural healing. I like to call it natural health and wellness the way God intended it to be. Please understand that this video is not medical advice. Only your medical doctor can give you that. This video is for informational purposes only. So before trying anything that you hear in this video, please always consult with your medical doctor or professional first. That said, let's be clear. Herbal remedies and other natural healing methods have been shown historically to be safe for millennia. I never intended to do this video, but so many of my family members, friends, and colleagues and clients encouraged me to do this as they heard me talk repeatedly on this topic, on how to stay safe in any flu or pandemic. I will be reading some information off of cards and shooting from the hip on other information. My goal is to stay on point and give you the maximum information in the shortest period of time. I want you to be empowered to take control of your health in any time of crisis with knowledge, experience, and the science to back it all up. There are so many videos out there spewing fear and doom and gloom, making many feel helpless with nothing they can do. Apparently, fear sells and gets views as many are glued to their screens. We are not to have a spirit of fear, but of power and love and of a sound mind. Fear and worry is not going to add 1 minute to your life. Actually, stress can be detrimental to your health and wellness. My goal is to empower you to take control of your own health, to show you that there is genuinely so much you can do right now to protect yourself and your loved ones. You can be helpful in these times of crisis and not helpless. We are going to explore all things in this video, explaining herbs, vitamins, supplements, multiple modalities, different theories, and what the science is behind them all. How viruses spread, how to avoid contamination, what to do if you are in a contaminated area, and give you all of the tools and clarity on how to survive any flu, plague, or pandemic. There is hope, genuine hope, with so many things that you can do to take control of your health right now. It all actually comes down to you. Here's a simple place where you can start. Whatever you eat, drink, or think affects your health, and that is part of your epigenetics. So let's be cognizant of that. Whatever you are putting into your mouth and your mind, you are either feeding disease or you are fighting it. So spread the word and hit subscribe, like, and share this video. I pray that we can be kind and helpful to one another in these times of need and rise above the fear and confusion. Again, please share this video with your friends and family to help give them informed choices in taking control of their health. So let's talk about germs and how you can protect yourself. First, let's talk about spreading them. Using a handkerchief is disgusting. I watch people blow their nose, fold it back up, and put it in their pocket, only to use it again. And then they shake people's hands, they go touching things, doorknobs, touching products in the store. This is not only disgusting, it spreads disease and illness. It's simply not acceptable. As, like I said, it spreads disease. A handkerchief might be okay as a fashion statement, but as a continuous, reusable tissue, no. Washing your hands is always a good thing, and exercising good hygiene and judgment is also key. Wearing a mask in public can also help you, but you need to still be aware of touching your hands to your face, to your eyes, to your ears. A mask can also help you from spreading disease, whether breathing microdroplets or from sneezing and spraying mucosa. An MIT study, Massachusetts Institute of Technology, noted that germs from one sneeze can travel from 19 to 26 feet. When you couple that with the Japanese study, which demonstrates that viruses can be spread just by breathing and talking via microdroplets, these droplets can remain airborne for 20 minutes. A well-ventilated space can help dissipate these viral droplets. Be cautious in public bathrooms also. Yes, If you can smell it, it is in the air. And yes, you are exposed to it. Unfortunately, every time a lidless toilet's flushed, it aerosolizes the fine mist and microbes. That fecal cloud dissipates in areas as large as 6 square meters, 65 square feet. The worst part about the public bathroom is probably the air dry hand blowers. They are a petri dish for collecting bacteria and disease. That same Harvard study exposed a petri dish to hot air from a bathroom hand dryer for 30 seconds. That petri dish grew up to 254 colonies of bacteria. There is a difference between bacterial and viral loads and proliferation. A flu and virus is very different than bacterial diseases. And here's why. A bacterial infection or disease doubles approximately every 24 to 48 hours. So you have time to realize and react to that infection. Bacterial infections can also be treated with antibiotics or herbs like berberines, garlic, or allicin extracts, just to name a few. A viral load doubles exponentially and therefore exponentially quicker unless mitigated. So you have the potential to go from minor symptoms to full-on sick very quickly. So with a virus and viral load, you have very little time to catch it and remedy it before it grows quick. That's how come it's extremely important to hit any virus quickly and hard while your body can still fight it off easily. Keeping yourself healthy with herbals, saunas, food, supplementation, exercise, and working within the body's natural defense mechanism, fever, and immune system can also fight off any disease or illness. So, what kills a virus? Let's look at some of the published research. There's been a lot of controversy on a book written by Dan Lee Dimke, PhD, where Dimke talks about heat and viruses and using a hairdryer to heat up your sinuses while using a spray bottle to keep the sinuses moist. Now, I'm not condemning this nor condoning it. That said, it has potential risks, and if you dry out or burn your sinus cavity or any potential damage that can quite easily occur from any of this, that could be detrimental. So let's look at some of the clinical research which illustrates that heat does deactivate viruses. Let's only explore the medically accepted, effective, and safe means of doing so. All of this will be based on clinical peer-reviewed research. You sleep on a pillow for 8 hours a night. You can easily mitigate viruses there. Wash your pillow and dry it in high heat. You can even take your pillow and pillowcase every night right before you go to bed, pop it in the dryer at the highest heat setting for 15 minutes, warming it up to 65 degrees Celsius or 149 degrees Fahrenheit. This will kill 9 different types of viruses on your pillow, and incidentally, your bed sheets and clothing as well. Again, this study showed that heat of 65 degrees Celsius or 149 degrees Fahrenheit had completely inactivated representatives of 9 virus families, including the traditional coronavirus. Another PubMed study regarding influenza demonstrating that inhaling air about 45 degrees Celsius or 113 degrees Fahrenheit for 20 minutes will much improve the symptoms of a common cold. Conversely, treating the common cold with aspirin caused an increase of the rate of production of the virus. There are other studies and clinical trials of treating flu by raising core temperature to 40 degrees Celsius or 104 degrees Fahrenheit, maintaining this for at least 24 hours, basically inducing an artificial fever and working within the body's natural mechanism to increase fever to fight disease. Taking any sort of NSAID, non-steroid anti-inflammatory drug, like aspirin, acetaminophen, ibuprofen, or others, to knock down a fever is literally knocking down your body's natural immune defense. Your body produces a fever to fight disease. The higher the fever, the better the immune response. If you need to lower fever, you can always do so by taking a cold shower or bath, or taking white willow bark, which contains salicin, which is a natural form of aspirin. Incidentally, there are studies how hot and cold water therapy, hypo and hyperthermia treatments boosts the immune system and produces systemic health benefits. So how do you safely elevate your body temperature and safely breathe in air that's potentially capable of deactivating viruses and increasing your immunity? The answer is a sauna. There are countless PubMed studies, Harvard Med studies, American Medical Journal studies on how the benefits of sauna helps fight disease and a lot of medical conditions. I personally use a far infrared sauna. However, all will work. Sauna usage has been studied to help kill pathogens and viruses. High heat increases the effectiveness of your immune system. Saunas can also help increase white blood cell counts by elevating your core temperature just a few degrees. These studies have shown, and I quote, short-term heat shock as a stressful condition could induce the expression of heat shock proteins that functions as molecular chaperones to protect cells against multiple stresses. HSP70 plays a protective and essential role during lung inflammation and immune injury via the activation of both the innate and adaptive immunity, either directly or indirectly. Andrew Luoff, a French virologist and microbiologist, shared the 1965 prize in physiology and medicine for just such a theory, reporting that high temperatures during infection combat the growth of the virus. So the next time you start to present with any symptoms of sickness, you want to thank your fever for helping you fight off your infection and work with it and not against it. There are many things that you can do to mitigate your risk in all public places and what to do when you get home. It doesn't matter if you are in a supermarket, shopping, traveling through an airport, or any public place, or potentially any disease-filled environment. You can always use intelligent steps to mitigate any exposure. First, use common sense. Do all you can do to avoid breathing in pathogens. Don't walk through the path of a sneeze. Wear gloves, wear a mask. Do your best to avoid any contamination. When you get back home, wash your hands, your face, or even take a shower, and that's just the beginning. Let's focus on where a pathogen can take root: your ears, your nose, your throat, and your eyes. A nebulizer is another way to get moisture and meds and herbals and food-grade hydrogen peroxide safely into your sinus cavities and bronchioles. Utilizing this can not only help you breathe easier, but you reduce that viral load mounting up in that area. A neti pot is also good. Believe it or not, a neti pot has many studies conducted on its use. A neti pot is safe and easy to use. Simply fill it up with warm water, saline solution, or herbals, and irrigate the sinus cavities. You can also include colloidal silver if you are hardcore, even a squirt of food-grade 3% hydrogen peroxide in the mix. Using 3% hydrogen peroxide in each ear by spraying it or holding it there for 60 seconds is also good for reducing that load in your ears. Just be cautioned that if you're spraying it in your ears and holding it for 30 seconds in each ear to 60 seconds, that you could feel dizzy, and that also could disrupt your inner ear. So don't do anything crazy after doing that. You can also gargle with peroxide. You can take peroxide, slug it back directly from the bottle, and gargle with it for 30 seconds. You can even brush your teeth with hydrogen peroxide. However, this is not a long-term strategy as it can make your teeth sensitive, but it is a good short-term exposure strategy. Herbal eye rinses that contain eye bright and golden seal and berberines are great for the eye. You just can fill this cup up with water, distilled water preferably, put the herbal formulation in, and rinse it back. You could also do the same, rinsing the eye with colloidal silver. Colloidal silver is great for rinsing the eyes. Doctors used to put silver into newborn eyes to prevent gonorrhea, syphilis, and other diseases. Now, antibiotic creams are used instead. Silver currently is on the World Health Organization's list of essential medicines and is listed as the safest and most effective medicines needed in a health system. By doing all of the above, you hit all areas of potential exposure. Also, when you are shopping, be aware that a virus can stay on a surface from a few hours to a few days. Also, the boxes and or mail that you get from your carrier can also be contaminated. So when you get mail, wipe it down with alcohol or spray it with a disinfectant. There is a saying, chance favors the prepared. So in the future, be prepared with all the things you need around the house. Buy the things you need now before a flu and pandemic hits next season, before the hoarding and the craziness starts at the stores. Stuff like toilet paper and tissues and peroxide and rubbing alcohol and food that can actually last. For instance, you can freeze meat, chicken, or fish. You can buy ghee, butter, tallow, olive oil, flax oil, hemp oil, lots of cruciferous vegetables and other low glycemic vegetables that can either be frozen or fermented. Don't buy chips, dips, sugars, or cookies, breads, cereals, ice creams, and foods that are high in calories but are low in nutrition. Avoid soda, sugary drinks, and all low or no nutrition foods and beverages. Again, whatever you eat, think, or drink, you are either feeding disease or fighting it. I urge you to consider and explore a ketogenic lifestyle. You will be in a metabolic state favorable to fight disease and mitigate inflammation. Ketosis is a healthy survival strategy that has numerous health benefits. So yes, diet has a direct effect on your outcome of disease. So let's touch on why. I'm not here to teach you how to do a ketogenic diet here. That can be done on its own episode. However, I will explain the basic premise and benefits. Nutritional ketosis can be achieved by depleting all of the sugar or carbohydrate reserves stored in your liver and muscles, called glycogen. When you deplete your glycogen reserves out of your liver and muscles, your body then instinctively switches to a metabolic state, which is called ketosis, in which you burn ketones or fats. Ketones are actually very efficient fuel for your body. The most abundant is called beta-hydroxybutyrate. A ketogenic diet is an anti-inflammatory diet. It is great for repairing the brain. It can help fix issues with insulin. It can be helpful with seizures. This is where the diet was initially studied and used for. It can help repair your metabolism. It is great for your gut-brain axis. It has been studied with cancer and so much more. There are many great sites and you can get information regarding a ketogenic diet. But a great source is Dr. Mercola, who has been a pioneer in the medical field and a very credible source. He has numerous books and has consistently been on the right side of natural medicine, often fighting for your rights, taking the fights to GMO foods, and too many other battles to even mention. In ketosis, your body burns fat for fuel. In a typical ketogenic diet, you will consume approximately 75% fat, 20% protein, and 5% carbohydrates. In ketosis, you really don't feel hunger. Reason being is that when you are burning your own fat and consume fats for fuel, the hunger hormone ghrelin, which signals your body to eat and promotes fat storage, is suppressed. In ketosis, autophagy happens. Basically, it's your body's way of cleaning damaged cells in order to regenerate newer, healthier ones. A ketogenic diet can help regulate cellular mitochondria, protect the nervous system, the immune system, encourage growth of new and healthy cells, especially in the brain and heart, enhance cognitive function, helps improve digestive function by restoring and repairing the gut lining, and protects our genes by maintaining the integrity and stability of our own DNA. Once you are in nutritional ketosis, you can easily shift yourself into a water fast. Scientific research shows that after water fasting for 3 days, your body produces stem cells. These stem cells can be used to repair your body, fight disease, and so much more. There are two amazing books by medical doctors that utilize fasting with their patients. Dr. Longo, with the Longevity Diet, and Dr. Jason Fung, The Complete Guide to Fasting. Both of these doctors clearly explain why fasting is the cheapest, most effective medicine known to mankind. Fasting is practiced in all major religions all over the world and now studied and utilized by the modern medical industry. This is another example how our diet dictates our health, with fasting being at the top of the list. Hippocrates, approximately 440 years before the birth of Christ, said, "Let food be thy medicine, and medicine be thy food." He also believed, "Do the patient no harm." I find it so amazing. At that time, he put so much emphasis on the gut and disease, saying, "All disease begins in the gut." A few thousand years later, we are just proving that out now, with so much attention focused on the gut microbiome, autoimmunity, and with now knowing that approximately 80% of our immune system comes from the gut. So at times of flu, pandemic, or any sickness, it's simply wise to work with your gut. Garbage foods will yield garbage results. Let's review a few herbs and supplements. Herbs are nature's wonders, filled with nutrition, natural plant chemicals called phytochemicals, alkaloids, and so much more. Herbs can be nutritive, restorative, calmative, cathartic, adaptogenic, and have been used safely and effectively as medicine since the beginning of recorded history. The Bible mentions herbs saying, "Let the leaves be for healing." So yes, there are many herbs that can help regulate, work with, and help build up the immune system. Terpenoids and lignoids from plant compounds can help inhibit viral replication, giving your immune system more time to adapt and fight any flu or virus. In the future, we can do a show on each and every one of these herbs, but for now, let's touch on a bunch of them. Licorice root regulates the immune system and protects the liver. It has been shown to inhibit COVID-19's ACE2 entry into the cell. Milk thistle would be a wise choice to add with licorice root because milk thistle also helps to cleanse and protect the liver and helps boost glutathione. Astragalus helps regulate the immune system as well and can help levels of alpha and gamma interferon, the body's own antiviral compounds. Astragalus has been studied regulating the common cold, upper respiratory infections, seasonal allergies, swine flu, fibromyalgia, anemia, HIV, and to strengthen and regulate the immune system overall. It has also been used for chronic fatigue syndrome, kidney disease, diabetes, and high blood pressure. Chinese skullcap root specifically has antiviral properties for SARS group of viruses. Kalagala can help normalize the immune system. It's also known as kaliwala. White birch bark contains butylenic acid, which is an immunoregulatory cytokine. These cytokines can dramatically affect not only the strength of the immunoresponse, but also its character. Spirulina, and add in its synogen chlorella, helps to protect the blood, build your hemoglobin, increase your blood oxygen levels, and increase your pH levels. Elderberry also helps regulate the immune system. Again, immunoadaptogenic herbs historically have been used to regulate immune system in regard to Th1 and Th2 response. Elderberry extract demonstrates potent antibacterial and antiviral potential against pathogens responsible for upper respiratory tract infections and strains of influenza virus. Ginger root has a strong digestive biofilm, antiviral, and anti-inflammatory potential. Horseradish, along with Brigham tea, can help you breathe. Also, horseradish has quorum signaling inhibition. Systemic enzyme capsules can also help with inflammation. They can help break up mucosa, biofilms, reduce inflammation, and so much more. This can be a great benefit in times of disease and pandemic. CBD Today, there is an abundant amount of research regarding CBD in regards to stress, anxiety, PTSD, brain function, immune system regulation. We have an endocannabinoid system with CB1 and CB2 receptors throughout the whole body. The endocannabinoid system is the largest neurotransmission system in the body. Not using your endocannabinoid system is like not using all the tools in your toolbox when you're building a house. Research shows that CBD is neuroprotective and neuroregenerative. It affects every organ in your body, your mind, your vagus nerve, your gut-brain connection, your autonomic nervous system. It is anti-inflammatory, it protects the liver, it can help break addiction, and so much more. I personally use Fortify Elite. It is a full-spectrum tablet that has high absorbability and is long-lasting. Quinine. Quinine is a drug that is used for malaria. Fun herbal fact that cinchona bark is the best source of quinine. That's where the drug actually comes from. Utilization of cinchona bark and Artemisia annua has been utilized successfully in treating malaria in other countries. Artemisia annua, or wormwood, or sweet anise, has been studied for its use in medicine as it contains artemisian. In this article, Artemisia annua has been successfully used for malaria for its ability to block Mycobacterium tuberculosis. There is a small study that was done in which malaria medications failed to help 18 critically ill patients. The attending physician in the Congo clinic acted under the compassionate use doctrine and prescribed the not yet approved malaria therapy, made only from the dried leaves of the Artemisia annua plant. In just 5 days, all 18 people fully recovered. This small but stunningly successful trial offers hope to address the growing problem of drug-resistant malaria. Plants are not isolates or synthetics. They are essentially alkaloids, foods, and phytochemical substances that are readily recognized and absorbed into the body. Lomadium dissectum, known as fern leaf biscuit root, is a great antiviral herb. The root extract completely inhibited the cytopathic effects of the rotavirus. It has also showed antibiotic activity against Mycobacterium tuberculosis and Mycobacterium avium as well. Cat's claw has a lot of immunological active alkaloids. One is believed to be isomer A, which increases the immune response in the body and acts as an antioxidant to rid the body of free radicals. The anti-inflammatory compounds of cat's claw may also work to kill viruses, bacteria, and other microorganisms that cause disease. It has been successfully used in Peru for many chronic viral illnesses. Nigella sativa, or black seed, has shown so many promises in so many different afflictions across the globe. It has been studied in protecting the heart because it contains thymoquinone. Nigella sativa has also been clinically tested with HIV and numerous other viruses. Mushrooms are amazing for the gut microbiome health. Prevotella is a bacteria that sometimes presents in COVID-19, causing inflammation. So keeping your gut microbiome healthy is essential. A mushroom blend along with pre- and probiotics is a huge asset. As this study states, the microbiota plays a central role in human health and disease by shaping the immune development, immune response, and metabolism, and by protecting it from invading pathogens. Old school herbal. Let's get into it. Here's a study in which the results indicate that camphor, eucalyptus, and menthol stimulate cold receptors in the nose. Camphor is extracted from the bark and wood of the camphor laurel, Cinnamomum camphora tree. It was used during the Black Death of the 1300s and the Spanish flu in 1918. It has also been used as a chest rub to aid in breathing to open up the sinuses. Vitamin D3 with K2 or MK7 is great for your gut-brain connection, vagus nerve, necessary for immune regulation, and so much more. A study concluded that vitamin D may play a major role in the inhibition of viruses. And according to a study led by the Queen Mary University of London, vitamin D supplements protect against acute respiratory infections, including colds and flu. Magnesium L-threonate. Magnesium L-threonate passes the blood-brain barrier. It's neuroprotective, aids in neuroplasticity, and can help with cognitive ability, attention, and focus. It is anti-inflammatory and can aid cardiovascular health. The next one's a big one, iodine. It's an antiviral, antibacterial, great for all glands. It's an anti-inflammatory essential element. It helps the body remove heavy metal toxins like mercury. I urge you to look up the research that Dr. Brownstein has done on iodine and infections and health issues. He was a proponent of iodoral, which has both potassium iodine and iodide. Basically, it's Lugol's in a tablet. Enhancement of respiratory mucosal antiviral defenses by the oxidization of iodine increase concentrations of iodide in airway secretions. It is associated with reduced respiratory sinusoidal virus disease severity. No matter how you look at it, you need to talk to your healthcare provider about iodine. Selenium. Selenium is an antioxidant micronutrient. It is an antiviral and supports glutathione and iodine utilization. B-complex. I prefer an enzymatic B-complex vitamin. Vitamin B12 supplementation improves rates of sustained viral responses in patients chronically infected with hepatitis C viruses. An Australian research team has discovered how specialized immune cells recognize products of vitamin B synthesis that are unique to bacteria and yeast, triggering the body to fight infection. Vitamin C in viruses. Vitamin C intravenous vitamin or IVC drip can be life-saving. Oral consumption is a great part of an overall wellness defense regimen. This is a common flu and pandemic strategy due to the broad spectrum of antiviral properties vitamin C has. Get acquainted with your local practitioners that offer IVC, especially if you feel the virus getting the upper hand. In Wuhan, this has proven to be life-saving. I'm sure that I'm going to mess up these names, so please don't judge me on it. Ji Young Peng, MD of the Department of Critical Care Medicine in Jianyan Hospital of Wuhan University, recently registered a phase 2 clinical trial on clinicaltrials.gov to test the efficacy of vitamin C infusions for the treatment of severe acute respiratory infection, SARI, regarding the novel coronavirus. Zinc. Zinc inhibits viral replication. Zinc is needed for immune cell development and communication and plays an important role in an inflammatory response. Let's talk about the mind, fear, anxiety, and stress. Stress and fear only make you more susceptible to disease. Stress causes dis-ease or disease. It breaks down your immune system. Meditation and prayer are powerful tools as they help eliminate stress. All religions believe this, and yes, there is a biological and biochemical benefit to this as well. Do you know that organ transplantees get some form of immunosuppressant meds, such as corticosteroids? Cortisol is a stress hormone. It is produced when we are under stress. In short spurts, cortisol can boost your immunity by limiting inflammation. But over time, stress decreases the body's lymphocytes, the white blood cells that help fight off infection. The lower your lymphocyte level, the more at risk you are for viruses. High stress levels also can cause depression, anxiety, inflammation, and an overtired immune system that will not function properly. Stress also affects the gut microbiome and the gut-brain axis. Studies demonstrate that the gut microbiota composition and activity are malleable over short time frames and influenced by psychological, physical and environmental stressors. Further, these studies demonstrate that the gut microbiota reacts actively to stress over both the short and the long term. For example, stress influencers can be physiological, psychological, influenced by your diet, circadian rhythm, environmental, and a host of other factors. The power of words and thoughts as part of your epigenetics affect your genetics. I often ask people, what is the one drug that stood the test of time? Most people answer aspirin or penicillin, but the only one drug that stood the test of time is the placebo. The placebo oftentimes even outperforms the actual drug. The power of the mind and the placebo and also the nocebo directly affect the outcome of your health. Prayer, meditation, positive thoughts lift you up. They eliminate stress and get you in touch with the promises of God. In 1981, Herbert Benson, he was a cardiologist at the Harvard Medical School, set out to disprove ancient meditation practices by Buddhist monks and their ability to change their metabolism and their physiology via meditation. The title of the article says it all: How a Scientific Attempt to Demystify Buddhist Meditation Yielded Astounding Results. There is actually now scientific evidence that prayer and meditation actually do effectuate our physiology. There are other modalities that too can be beneficial. I will be doing an entire video on each one of these in the future as they deserve their own spotlight. But for time purposes of this video, I'm only going to touch upon them. Pulsed electromagnetic field therapy, or PEMF therapy. There are so many published peer-reviewed studies on PEMF. Here is one study with PEMF and the immune system. I encourage you to do your own research here. Pulsed electromagnetic field therapy goes a lot deeper than this. Rife. Although it has been a hotbed of information, misinformation, and a roller coaster ride of reading, I believe it is definitely worth looking into the research of Raymond Royal Rife. His work is just recently being explored by the modern medical community. He was truly a genius of his time whose work will carry on indefinitely. Low-level laser therapy and photobiomodulation, perhaps in recent history, has the most amount of studies and FDA clearances for pain, inflammation, acne, fungus, brain, wound healing, vagus nerve stimulation, and so much more, with zirconia lasers topping the list. Light therapy, or lights, currently are being used in hospital operating rooms to keep the rooms disinfected and prepped as a germ-free environment to perform surgery anytime. EWOT, which stands for Exercise with Oxygen Training, basically is breathing high concentrations of oxygen when you exercise. If you have ever seen an EMT pick up a patient, one of the first things that they administer is oxygen. I will be doing a show solely on EWOT alone and the benefits of oxygen. The original EWOT system was invented by Dr. Manfred von Ardon as an oxygen multi-step therapy. Dr. Ardon, a German nuclear physicist, he was an accomplished inventor and researcher. He had over 600 patents in radio, television, medical, nuclear technologies. He invented the first working scanning electron microscope in 1937. I urge you to look him up. What a fascinating story and genius of his time. Homeopathy is something that I don't even claim to come close to my field of expertise. I am not a homeopath. Homeopathy was created in 1796 by Samuel Hahnemann. Its practitioners are called homeopaths. I would love to do a future show that can feature a homeopathic master, as I believe that this is important. Enema. Yep, we just went there. Fasting and doing a high enema, clearing fecal matter out of the large intestine, helps keep toxins away from your organs and gives your body a break, diverting those resources to fighting the disease instead of digestion and elimination. Enemas have been used historically from different cultures and continents, and yes, even today in modern medicine. Do you ever hear the saying that no one could ever remember? Is it feed a fever and starve a cold, or is it starve a cold and feed a fever? When you are sick, stop eating. Drink bone broths and have chicken soups. Keep the load of digestion and elimination to a minimum. Again, fasting is the cheapest and most effective form of medicine known to mankind. Ozone. Ozone can help significantly in times of health crisis via insufflations done either via the ear, rectally, vaginally. Do see a professional, as breathing in ozone can irritate your lungs. You can breathe it through a bubbler with olive oil, but with anything new, there's a learning curve. And a professional guiding you through this would be extremely important here. Copious volumes of research have provided evidence that ozone's dynamic resonance structures facilitate physiological interactions useful for treating a myriad of pathologies. Today, there are many mainstream medical doctors that have embraced this multi-pass UVB method. Ozone kills bacteria, virus, and fungus. In vitro, I honestly do not think that there is any disease that can hold its own against ozone. Another gas is hydrogen, specifically molecular hydrogen. This particular study is hydrogen therapy for COVID-19, acute respiratory distress syndrome, ARDS. Hydrogen has no known toxicity and is the smallest element on the periodic table. You can actually get molecular hydrogen in gas tablets called H2 tabs. Last but not least, I also take stabilized allicin extract for its antibacterial, antiviral, and antifungal properties. Allicin is the primary active compound produced when garlic is crushed or chopped. Numerous studies demonstrate that allicin doesn't care if the invader is a drug-resistant bacterial strain or any mutation of any virus. Allicin's immunomodulating properties works with your body's innate intelligence to help kill any invading pathogen. These are the 7 best doctors of all time. Dr. Sleep, Dr. Go in the Sunlight, Dr. Breathe Fresh Air, Dr. You Need to Exercise, Dr. Drink Pure Water, Dr. Prayer, Meditate and Relax, and Dr. Eat Good Food. I'd like to recap a short list of everything that I do. Again, this is not medical advice, and you should always consult your doctor for that. I predominantly live a ketogenic lifestyle, especially during times of mass sickness. I always opt to go out prophylactically to protect myself in public. When I get home, I peroxide each one of my ears. I gargle with peroxide. I use a neti pot to irrigate my sinus cavities with an herbal rinse or sometimes adding in a little bit of hydrogen peroxide. So basically I'm flushing out where the virus can take hold in my ears, my nose, my throat. I also rinse my eyes with an herbal antiseptic. Sometimes I utilize colloidal silver. I take vitamin C, D, and zinc every day as it helps the body fight viruses and inhibits viral replication. I take iodoral, which is iodine, every single day. I take systemic enzymes every day to mitigate mucosa and inflammation. I take herbal formulations that I make, which it's quite beautiful and quite amazing to do, including a mushroom blend that I take every day for the gut microbiome. I use Fortify Elite CBD. It's one of my favorite CBDs. I choose not to ignore my endocannabinoid system, and this is a 25 milligram tablet that stays in the body long. I smile, I laugh, I relax, I watch funny shows and lose the fear and worry. I focus daily on the thought, knowing that my body is more than a conqueror. I always try to focus on the positive. If I feel any onset of sickness, I go hard. Disease comes against you hard, so you have to come against it harder. I hit the herbals and the supplements hard. I hit the sauna. I hit the neti pot. I peroxide my ears. I gargle with 3% hydrogen peroxide. It's a lot easier to fight a smaller viral load as it exponentially replicates, and I always want to be ahead of the curve. You have 2 options. You can take control of your health build your immune system, change your lifestyle and your epigenetics, or you can give that privilege and option away to others who might not necessarily have your best interest at heart. I hope that you enjoyed this video. I encourage you to hit subscribe, like, and share this video. Be careful, be vigilant, and be prepared. God bless.